For nearly 50 years, Biotics Research has been a trusted leader in the nutritional supplement industry. Known for uncompromising quality and innovative delivery systems, the company continues to advance the field through ongoing research, unique formulations, and rigorous quality control. Family owned with a rich history, Biotics Research is most proud of the strong partnerships it has built with the healthcare professionals. On Adjusted Reality, we talk about living strong, vibrant, and healthy. And that starts with the environment around us, whether it's practice or at home. Force of Nature Pro makes it easy to protect your whole being and those you serve with an EPA-registered hospital-grade disinfectant that's powerful against germs, yet free from harsh toxic chemicals. It's safe on hands, treatment tables, and everyday surfaces while supporting better indoor air quality. Plus, it reduces single-use plastics and costs up to 80% less than many traditional products. If you're ready to align your life, your practice, your family routine with a cleaner, more sustainable future, go to forceofnatureclean.com for home and forceofnaturepro.com for exclusive business pricing and limited time offers. Healthy space, healthy practice, healthy life with Force of Nature Pro. Welcome to Adjusted Reality, a podcast series trusted by the adjusted and brought to you by the Foundation for Chiropractic Progress, where we learn from athletes, celebrities, influencers, and healthcare professionals about how to optimize health in a fun, relatable way. Join me, Dr. Sherry McAllister, as we welcome author and healthcare advocate Gary Jacobs. Now, Gary Jacobs is a healthcare advocate and lobbyist working inside the system to transform it. As a meditation teacher, he has seen how self-awareness leads to better leadership, policy, and care. His approach blends strategic expertise with the power of mindfulness, creating change where others see gridlock. Gary shows leaders, policymakers, and healthcare professionals how to get results. His philosophy? A stronger, more sustainable healthcare system that starts with empowered stakeholders engaged in communities and smarter policies. First and foremost, I'm absolutely delighted to welcome you to the show, Gary, because we have our books going out basically at the same time. So welcome and congratulations.
Thank you, Sherry, and that's great. I'm
Well,
glad to have somebody marching along with me on this journey.
it really is, and I give you a big shout out, Gary. We talked about before the show started that you had your Times Square ad. It was absolutely phenomenal, and as we joked about, I said your face was bigger than two buses layered on top of each other. So you're really big, Gary, and I'm glad you're with me.
Really
All right.
not, though. Really, as you know from the book, I was a little guy growing up, remained a little guy, and figured it out.
You did, and I love that part of the book. So let's just start with that because I think, Gary, so many people in today's world think you have to have all of the resources and everything figured out to be successful. And I loved your book because you really did see what needed to be done in your career so that you could be the trusted voice. So tell me first about what actually built your career as a trusted voice in health policy and government relations, and maybe even start with how you even got down this road.
So the answer to the first part of that question is I've done the work. And kind of like Tom Brady would always say, how come you're the GOAT? How come you're the best ever? I do the homework, I did the work. I learned Inside Now Washington, and I learned advocacy um, as an adult, not as a kid starting his career. So I kind of knew the basics of how health policy worked at the ground floor level, the closest to the person getting the care, if you will. And I learned that in many different machinations, whether it be in physicians' offices, whether it be in their homes, whether it be in facilities that they didn't want to be in, but there was no other place for them to be. And taking that experience, all those experiences in probably the most bizarre, fraud capital of healthcare, being Miami and South Florida. That's where I got my basic training. So I learned the good, the bad, and the ugly of the execution at the localest possible level of delivering all kinds of care to people who needed it.
So you saw firsthand the fraud. And for our listeners today, the greatest impact you can have in your life is the first and foremost, the understanding of what's going on. And I think having you, Gary, and in your new book that just came out, The Zen Lobbyist, a mindful approach to transforming healthcare. So with my listeners listening, we do have a big road ahead of us. We have transformation that needs to happen. And I can say, because you're the GOAT in looking at transforming healthcare and you've done the work, tell me first, um, lobbying is a big is a very big opportunity to get messages out. What inspired you to kind of reimagine it through the Zen lens? Because I think it's quite beautiful, and in today's really tumultuous relationships that are happening around the globe with politics, and how in order for us to get something done, we do have to have these conversations, and they're tough. Yet you come with such a brilliant, bright, and engaging attitude, and I loved reading your book.
Oh, thank you so much, Cher. And that was the trickiest part that I really wanted to be able to nail down. And that was, how do you blend your belief system into the work you do, and and it's part of the path to find who you really are and how to be the authentic, true self in the work you do, in the life you live. Because it's so easy to be abstract and not be anchored and go with the whim and live
Right.
in that world of fantasy, if you will. I was very lucky that I had some medical problems that manifest in a behavioral way and then in a physiological way. And the lessons learned through those experiences led me to a path of finding clarity in chaos, managing stress and not living the stress, but being aware first that there was a problem was probably the most difficult part of that realization for me.
Sure.
There's a lot of talk about self-realization. So who really are you, and who really am I, as we have this honest conversation with each other. And I've gone through several practices to kind of develop who I really am, at least from my own perspective. And to me, it was finding meditation as my anchor, mindful living, and living in a way that was appreciative of every moment of my life, and living with other people around me and giving them the same respect that I want in my life, that I want to give to other people, so that it would be reciprocal. And the only way you can do that is finding the divinity within yourself and connecting with the divinity to somebody else. And then everything becomes one, if you will, which I could talk about in detail for a long, long time. But the truth is that once I realized who I really was and what my dharma and purpose was, I was took all the aggressiveness of being an entrepreneur in an environment like South Florida, which is guns blazing, watch out all the time, learning that your back and front is very important to have somebody protecting you. But getting through that process and then realizing that I can make the changes in myself and then apply it to my work was, oh my God, that was like, let me have at it. Why am I wasting any time living in this fabricated world? Let me get to the real sense of who I really am and let me apply it to the work I do. And let me take each member of Congress one at a time and teach them that here's the trick. They don't realize how complicated an area like healthcare really is.
Yes.
And they've got to vote on a lot of issues, Sherry, related to our day-to-day work. And how are they going to get the information if they don't talk to people like you or me? They've got to find allies that they can trust, not people that just give them checks, but people that can develop a personal relationship, be empathetic, because at the end of the day, we're all humans sharing a planet together. We all have to relate to each other in a way that's genuine and real. And I've tried to exemplify that kind of behavior in dealings with members of Congress, members that I never would imagine in my life that I could possibly be friends with, but I am. And I mean, whether it's, watching the Army Navy game with a bunch of representatives that are Navy people and Army people, and I would be invited to that kind of thing, I wouldn't believe that. But on the human to human level, we all connect with each other in some way. Somehow we find that. And the more you do that and the more real it is, then people are attracted to you and they want to, they'll call you. Members have my cell phone. They call me before votes to just get my opinion on what do you think about this? Is this possible in the real world? Yes, but here's the challenges. A lot of people I did that with during the Affordable Care Act days and the final votes leading to quote unquote Obamacare. He never liked that name, and neither did any people around him. They always wanted it to be called the Affordable Care Act. But in that process, so many decisions had to be made along the way, and it was a chance to educate people at every instance. So my role I found was to educate, communicate, and advocate. And I put those all together in a principle called ACE, and I live it every day.
It's really fun to hear someone like you that has done the work and done it with a kind grace. And you talk about stillness and strategy, compassion is influence, and gratitude is renewal. And when you think about the healthcare system, it is very complicated because we've made it that way. And there's people that are looking at the healthcare system as only the disease care system. It's only about people that are currently suffering in chronic pain or in chronic disease categories. But where I see your influence is that you've done the homework and you've been in so many different places that the reason why your influence is so important to someone who is in Congress is because you've been in a variety of different places and you've taken the wisdom, and your kindness shows through because you're not trying to make this a political issue. You're trying to make this a bipartisan moment where we can have a realization that our system does not work. I think we can all agree on that. And there are opportunities for it to actually work in a less complicated way. And I think that was, as I read through your book, and for those that are listening right now, there is a place where healthcare can work. And it means health care. It doesn't mean disease care. And I love that you have been able to see the various ways that opportunity arises. Tell me a little bit about, as you were working on talking through some of the reframing pieces and influencing people in Washington, what does compassion being influenced mean to you?
So influence in Washington, oh my God, Sharon, that's like the biggest thing, right? And so many people get caught up in the money part of influence. So let's kind of dissect that a minute. So if you want to meet a member of Congress, at some point you're either lucky and you run into them. I live in Old Town Alexandria. It's the historic part of Alexandria that's just beautiful and very walkable and just a great place to live. But in the whether I'm going out to dinner or whether I'm at Whole Foods or Safeway or shopping, I could run into many members of Congress just in their day-to-day activity. At my dry cleaner, anywhere you go. So I learned that not that you have to be on all the time, but if you have to be on, then you're forcing something, right?
Hmm.
So if you're just naturally in this place of calm, serenity, and approaching every day in a happy, sensible way, then you don't have to put anything on anymore. It's kind of like exaggerating truths. You have to remember the lie.
Yeah.
And why bother if you don't have to? And why do you, if you're lying to advance your own agenda, it's, I'd say that's fault. There's a challenge to your thinking in the first place, right?
It's so incredible, Gary, as you shared that, as the people that are listening right now, they may feel like they have to show up with a mask on, that they have to show their work people, sometimes even some of their friends, because the influence that they have could in fact be something they're trying to garner in their life so that they can get whatever they need. I truly believe, like you, and especially when it comes to social media, you have to be authentic because people know. I like to show up looking my best, but at the end of the day, if I can show a social media post that shows me just being me, I think it's much more relatable to the average person because at the end of the day, you're either following a path of higher opportunity or you're following a path that takes you to a lower, I guess you would say, and I kind of love this quote, and I think Gary, you will like it too. It's Socrates: contentment is natural wealth, luxury is artificial poverty. And
I like that.
when you think about living your life, you can have all the luxurious things, but are you really living true to you? Are you living true to making the world a better place? And I think how I read you on compassion as influence, it's it's being authentic to you and also to the person who's standing in front of you and not trying to put on those airs that people do to get what they want. And it's really you're kind of more transparent. And I also like what you said that gratitude is renewal. Share with me what you mean by that.
Oh my gosh. So gratitude being renewed. So I take the three legs of the stool and you start with stillness because there's so much noise, so much chaos, so much to get you off track. So you need to have a pathway towards resilience that allows you to be the best version of yourself, right? So every day I begin my day in silence. I wake up, do a little bit of yoga stretching, and then I move into a 20-minute meditation. And I happen to use a mantra in my meditation. And I do that. I teach meditation. I teach a style that Deepak Chopra taught me back in early 90s. So it's called primordial sound meditation. And it just fit with me very well. So it kind of grounds me in the reality of who I am and going into my day focused, ready for being enthusiastic, being respectful of everybody around me, whoever they might be. The heroes that we learned during the um, COVID days were the public employees that were doing the things that kept our cities running,
Hmm.
kept our towns moving, people that did the dry cleaning and people that took our money at the grocery stores. They're all heroes and means we're all heroes to each other if we start caring more about each other and using love as a principle. So as I focus on stillness to ground, compassion, demonstrating compassion as a practice is not just saying, oh, I'm compassionate. It's working the practice of compassion as you would work anything you're trying to learn, and then instill it in your being and being able to be effective with it. So going in, being using empathy, using compassion, caring, authenticity, and then the key at the end is gratitude because if I'm thankful for everything that's happening in my day-to-day world, I'm going to smile at you. I'm going to give you like a little heads up. Thank you. I'm going to say thank you. I'm going to appreciate your being there and helping. And whatever it might be, the guard who let you into the United States Capitol. Why would I not go in with a smile? I'm going into this beautiful, beautiful building that is the hallmark of freedom and democracy as we understand it. People get, a little crazy at where we are right now, but we are right now in a place and time that'll move on and we'll be back to another place, is the way I view it. And we're very good, we're strong, we're resilient, and we'll figure it out because good people find good solutions. And I kind of buy all that. But at the end, if I approach my work with stillness and great example, Sherry, and I'm sure you find this in your work too. You're going into a meeting, you just had news that something really bad either happened in your work or in your personal life, and you still got this very important meeting you got to go to. What do you do? Do I panic and start talking about it? Or for me, I take a breath, close my eyes, center myself, go deep for a moment, and then come back and feel renewed. And that renewal is what I get from my gratitude, part of my practice as well. So gratitude is renewal is critical. And in our work in healthcare, with so many of my peer group retiring instead of keep it going on, which is a big, big problem that gets the whole health shortage issue. That if we're not going to be looking at gratitude as renewal and be appreciative of each other, people are going to leave in droves. And then our healthcare system's in real crisis because there's
Yeah.
not enough people to care for the people.
That's very intuitive to really understand is that we're trying to keep people in their jobs. We have, as you noted in your book, the primary care physicians are leaving in droves, and we need them to ensure that patients are properly cared for so they don't have long wait lists and being able to get in when they need to get in. Now, in the book Adjusted Reality, we talk about alignment, and I think you're going to like this question, Gary, especially of the nervous system as the foundation for clarity, resilience, and better decision making. Now, I want to take the Zen from you and build the adjusted reality in that Zen moment. From your perspective, how do you see the personal alignment influence the way leaders kind of show up in those policy conversations and then ultimately shape our healthcare system? And what I mean by that, we'll get into the next question. How do you see that when people show up? Like you, when they're in a better alignment, when they're in a place that they have the influence, but they also have to have the integrity, they have to have the authenticity, and they have to have a reality that, yes, they're still working for their constituents, but at the end of the day, healthcare should never be one of those combatant places that people think is a here today, gone tomorrow. It's trying to take care of people in the ultimate altruistic way, and government really should have that support system with it. So, what are your thoughts on, way leaders show up in policy conversations when they ultimately show up like you?
So if they're reactive, and I will say this last year has been a very reactive year, and people are, it's kind of like nobody. It reminds me of a Crosby, Stills and Nash song or something. Nobody's right, or Buffalo Springfield. Nobody's right, nobody's wrong. Everybody, but we can't just line up on sides all the time and say, I'm on the right side, you're on the wrong side, because sides get to a middle ground
Yeah.
and eventually they mesh together. And the same people that were your enemy or your friends at the end, you know, I look in my spiritual readings in the Bhagavad Gita, you know, it's a great story because Arjuna is the leader of one side and his charioteer is Krishna, and he's teaching him all the lessons of life through this battle that he's got to face now against his friends, family, and others that are on the other side of that issue at that moment in time. But if he learned the skills that Krishna teaches him during the different chapters of the book, and there's only, I believe, 18 or something like that, um, he learns all the life skills that sets him apart. And in his constitution, he's a yogi with the principles of love, compassion, loving kindness to all beings, and it becomes who you are. And when that becomes who you are, you may get that by being very committed to your faith, committed to your church, to your synagogue, to your temple, to whatever is your place of worship. Um, there's not a difference. If I meditate and you pray, if you chant, um, that's fine. I mean, all of these places are getting you closer to understanding who you really are. And when I talk to Congress people in this way, they don't like run away and they freak out. I mean, I can have this conversation with somebody on the Christian right or the Orthodox Jewish or Islamic world. And at the end of the day, we have more in common than we have separating us. My view for healthcare going forward, though, is that primary care in this country has to be reimagined, and it's got to be led by a team of individuals that include everybody from nurse practitioners to physician assistants to yoga teachers, meditation teachers, personal trainers, chiropractors, behavioralists, all of this.
It is fundamentally, as we walk through this thing we call healthcare, which you and I discussed briefly just before we went on air, is the podcast has an adjusted reality, and I see the line to which we need to, and I think you'll agree with this, be on the optimization and prevention aspect of it, because the more we can pull people from the sick care aspect of it, the better they live, the better our world spins, and the more opportunity to be creative and actually do the jobs that need to be done and be able to bring together, like you just said, we're more alike than we are different. We can start seeing our alignment in how we're the same when we're feeling better, when we're strongly committed to helping others. When you're feeling well, you're more likely to help someone. When you're feeling sick, it's very difficult because it's like it's a withdrawal from your own personal bank account. You know, your healthcare is like I like to say, it's an investment piece. And Gary, you've gone through and had some very significant withdrawals with some of the issues that you had to face with. You're a marathon runner and you think you're totally on top of the world, and all of a sudden you come into a blood clot, and you have to be able to quickly understand, and the people around you needed to quickly understand that, you know, you're having a significant problem right at this moment. So there's no one who better for committing to true healthcare than someone like you who's been in the trenches, who've seen the Affordable Care Act start, who's been involved in value-based care, and then looking at where we've been, which is fee for service. And these are the places where I think, Gary, you play such a role when you wrote the Zen Lobbyist is you see it very different than many. And has that created a lot of chaos in your life, or are you seeing it getting better and people are starting to see, you know what, we need to have people that are looking at prevention and optimization, not just focused on the decline of our health?
Well, as I said before, Cher, the truth is the Secretary of Health and Human Services, whatever anybody might think of him, he's hot on that agenda of prevention and giving citizens the tools to maximize their health wherever possible. And there's lots of work being done in this area right now. But let's face it, a system tied to transactions, a system tied to paying for every service you receive is not going to be there for the long haul of working with me as an individual to keep me healthy, to remind me that my hemoglobin A1C might have risen by 2/10 of a point. And if I look at that, I'm going to say, well, it's not that big a deal, still below where it needs to be. But if I look longitudinally over the last 5 years and see that it's gone up zero point 0.2, zero point 0.2, zero point 0.2 over those last 5 years, now I have a problem that maybe I can self-correct. Maybe I'm eating too much ice cream before I go to bed. Maybe I'm drinking too much artificial sweetener that is triggering an effect of, ooh, I want more sugar in my body. So I'm gonna, if I can't get it from those little packets, I'm gonna get it from the food that I want to eat, right? So there's all kinds of triggers, but I begin with fee for service was appropriate back in the day because doctors had to figure out how to get paid, hospitals had to figure out how to get paid. It gave birth to Blue Cross and Blue Shield for doctors, Blue Cross for hospitals. And when you track the history and you look at the things that happened along the way, there was every now and then a sentinel moment where change could occur, but the politics always trumped the policy.
Oh,
And and that's a big reality that people need to be aware of. So you may know something is right, and members know this too. I know that's bad policy, but honestly, leadership is all over me and they're gonna run somebody against me unless I vote this way and blah 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 blah. So there's a lot of dynamics, and I think it's why a lot of members are retiring quicker and sooner and faster lately than they ever have. But it's a hard job to live the politics and live the policy now in DC. And you see it on the news, but I don't know if news is fake or news is what, but news is a particular moment in time, like a photograph, right? It's a particular moment in time, and people are responding to that moment. And there's one faction on this side, there's one faction on that side, and before you know it, now it's an issue, and it's maybe a negative or a positive, depending on how you think. But the person that started that um, really wasn't trying to necessarily be an evil person, is the way that I look at it. There's a big issue around kids and wanting to, kids that realize maybe maybe I'm the wrong gender. Maybe I need to change my gender. So a friend of mine who's a member um, gets like a rap because of his look and his history, that he may be a really tough guy. And he got assigned the issue of understanding for the caucus, that gender issue on kids, and he came to his own conclusion based on his research, and he had his sources and he had his information that he couldn't support it, and he couldn't support the particular vote that he had to vote on. So he recommended to everybody else that was listening, I can't support it because of this, and the facts. And then there's another side that goes, well, hell with the facts. I just really think that's bad because I know it's right for people and maybe they should have their choices. So all I'm trying to say is that it gets very convoluted, and that's really why, to me, the idea of knowing who you really are and how you act out of that knowledge is so paramount and so important to add to the lexicon of words and discussions around how policy in the country is made. Because if you just scream and yell and I'm the loudest voice in the room,
Yeah.
which you've seen a lot of, right? But doesn't have to be that way. And the decorum of the United States Congress typically doesn't allow that kind of behavior. You know that you can't even go, sneakers are very vogue, and I love wearing sneakers, even with suits. It just becomes a thing. And then you match your sneakers to your suits to your
There you
whatever,
go.
and it's a whole dynamic. A particular congressman, Jared Moskowitz from South Florida, I happen to know his dad growing up, and he went to school with my son. So I've watched him grow into this role. And he's a sneakerhead, if you will, somebody that loves sneakers. So he went to be on the floor early in his career with his shiny new sneaks. And they said, sorry, Congressman, you cannot wear sneakers on the floor. So he's made a caucus of other people that are like-minded, Democrats and Republicans, who like to wear sneakers. And the sneakers now are pretty cool what they can do with them.
It's a
But
small,
that's how
it's a
change
story.
happens.
Yeah, it's a story that actually reflects how we grow. And the one piece that I think identifies across the aisle is if we're not growing, we're dying. And that really becomes, I think, a starting point to where you have written in the Zen Lobbyist is we have a responsibility to have these policy conversations, but to be authentic to who we are so we can talk about what we need, and that the advocacy that happens around us is only as good as the honesty that's in the room. And
Exactly.
that when you reflect on that truth, and truth can be someone's perspective, and that is an interesting part, and I think it's why we start challenging. And like you said, it's a photograph in time, and the way someone sees something may be the truth for them. They may see someone in a red hat, but they forgot the yellow strap, the yellow stripe on that hat. So was it them trying to be deceitful because they didn't want to talk about the yellow stripe on that red hat? No, it was that's what they saw at the time. And we have to reflect and give a courteous conversation to really be able to open up these decision making moments. And it's the same thing that you also wrote in the book, where it's not transactional. Healthcare should never be transactional. And that when you walk in and you get 5 minutes and the doctor gives 5 minutes of speech and then you get a 5 minute wrap up, at some point, it doesn't feel good. And really, when we start breaking apart health into its silo of true health, which is what you and many have decided, that patient centric opportunity that's personalized and that is full of caring and opportunities to ask the questions, be respected, and have the choices, I think are really, really important. And I think, Gary, where you sit in having taught students in American universities about the business portion of government relations, what lessons do you hope taking away now that the next generation of advocates take from your book and also from your lengthy career where you've done some amazing work?
So it begins with Shakespeare, to thine own self be true. And you can't be true to yourself if you don't know who you are. So there's a meditation I do in the book. I won't do it right now because I know our time would be, and then you and I could get lost for a while. But there's a meditation that is focused just on that identification, and sometimes I'll do that daily for a week or two because I'm getting a little lost out there.
Mhm.
Or sometimes I'll just stop, get focused, and then move back into these practices. But part of what I'm trying to say in the book also is that you just can't say I'm a loving human being. You have to work at being a loving human being by understanding love, understanding how you relate to love and what it is going to mean when you give love and you receive love. If you don't do that, then you begin this journey of never knowing who you really are and be lost. And being lost leads to bad behaviors and doing things that the good you would never really do. And the more you understand that and the more you evolve and grow, the better we all are as a society and we all learn from. But in thinking about a lot of where we're going, um, I want to be clear because I know where you go on a lot of this thought, Cherry, that in the big tent, primary care to me also means physical, mental, and spiritual health. So if you look at what a hospice relationship is, it's one, a hospice and something called PACE program. I forgot the acronym now, but it's generally for the sickest of the sick and Medicare and Medicaid beneficiaries. In San Francisco, they have a program called On Lock. In all in your own communities, you'll see PACE programs. And why I bring this up and why I bring hospice up, because they're all inclusive programs that get you, the entity providing the services gets paid a flat rate per person per month, and they care for that person with this whole entourage of chaplains and hospice and therapists of all sorts. And I think that fee for service won't pay for those things. So the idea of a big population health kind of payment to primary care to manage people through a process is a solution. Is it the only solution? No, it's my solution based on my life experience. Um, Part and parcel of that is the role of mental health. Mental health is a real chronic challenge in the country today, and people, docs can pick up on this. I think in your practice, you pick up on mental health issues, but I got hit really bad because of an event which I talk about in the book with panic attacks brought upon by an unimaginable amount of stress that I didn't even realize was festering inside of me. I was just, have a drink, I'm calm, I relax, and it was okay, and life would be on, and my wife would talk me down, and everything would be fine. But after a while, all of that stress of the entrepreneurial lifestyle that I was living, little sleep, not great behaviors in general, but being aggressive and going out there and battling the battles. I landed up where I woke up and I couldn't even get in my car and drive because I was like removed from reality. And it was just a very weird feeling that you go to your doctor, try to talk to them, they go kind of, I think I get it, but I don't, land
Yep.
up with medication. And medication to me was a negative. It worked bad on my body. What I ended up finding was something called biofeedback, which is a way to kind of have your body react and then study internally self-realization again, studying yourself reacting to stress and how it would and how your body just reacts and trying to understand that. And then just by accident, I land up in La Jolla in San Diego at a conference of home care companies. And I said to my wife, Stace, why don't we there's a new place called the Chopra Center for Living or something, I don't remember. And it was brand new. Deepak had just moved from Boston to La Jolla. David Simon, a physician in La Jolla, said, let's create the Chopra Center. They kind of were really good pals during the Transcendental Meditation movement and Maharishi Mahesh Yogi, they were both very involved with. So they became really fast friends. Two docs, they were into research, into documenting, and then developing their own approach to the next part of what primordial sound meditation would become. So I was very fortunate that by accident, we landed up in a weekend program. And when I got to the airport with my wife, I said, Stace, everything I was learning in biofeedback and learning in all of these other things was really all about yoga. And all I had to do was learn the 8 limbs of yoga, live that yoga in my everyday world. And then I'd start to understand that there's a light and I could bring that light to the world. And honestly, that's kind of what set me on my path.
What's so beautiful is Gary, you are a light, and your time today was not lost on our listeners, because as we start to adjust their reality, it becomes a moment where I think you live the mantra. It's deeds, not words, that matter. It's being able to advocate for the loved ones that you have and yourself, and being able to recognize and embrace when mental health issues come to the surface. We need to be strong enough to help ourselves into choices that will make a difference. Gary, it has been absolutely a pleasure to be with you today. I know that our listeners are going to want to pick up the Zen Lobbyist. It is a mindful approach to transforming healthcare, because when you read it, you're going to start thinking about how you're acting throughout the day. So, Gary, thank you very much for joining us today.
Well, thank you, Sherry, for the opportunity to talk about it and to talk with you and meet you and get that infectious smile and bring it. Hopefully, we can light up the world a little bit more
Together, we
together.
will do that, my friend. We will adjust more realities with brightness rather than darkness. Thank you so
Exactly.
much. I want to thank each and every one of you for tuning in to Adjusted Reality as we spoke to Gary Jacob about his book and his work as a healthcare advocate and a lobbyist. Now, Gary is in tumultuous times, and he shared that with you. I think many of us also face those realities: to be authentic to ourselves, to be often challenged by questions that we don't agree with, and we want to be able to be heard, but we also need to listen. And I think that is one of the lessons that Gary brought forward for us. It is really about deeds and not words. It's about making the world a better place, because you're in it, and the people that you love and adore, they are depending on you. And that is, I think, why reading Gary's book, The Zen Lobbyist, may in fact change your reality. Now, this podcast was brought to you by the Foundation for Chiropractic Progress. We know life moves pretty fast, and we want to make sure you never miss an episode. So visit f4cp.org/adjusted reality to subscribe to our newsletter. Now, while you're there, make sure you pick up a copy of Adjusted Reality, the book. Yes, it is out. It is out in the wild. You may, in fact, find it in an airport near you. Also on Target and Walmart, and anywhere you buy your books, Amazon, Barnes & Nobles. And if you're interested in hearing from a specific guest, you can always send us your guest recommendations. Don't forget to subscribe, share the podcast with family and friends, rate and review. If you're feeling so inspired to learn more about chiropractic or find a doctor of chiropractic near you, you can visit f4cp.org/find a doctor. We appreciate your support and look forward to checking in with you again soon.